The incidence of mental health issues among student veterans is about twice as high as the overall student population. However, veterans are more likely to hold negative attitudes towards mental health care because of a fear of embarrassment, a self-perception of weakness, or feelings of being misunderstood and disconnected from the general public. They therefore may be less likely to seek counseling or other treatment. Simply encouraging a student veteran to connect with primary care can be a good first step towards improved mental health and increased openness towards treatment. The great distress provoked by trauma is short-lived for many veterans who show considerable resilience. Longer-term impacts from trauma, such as PTSD, do, however, occur in less than 10% of veterans. Transitioning out of the military can create a great deal of stress for veterans, as the identity reformation that occurs during the adjustment to civilian life can lead to isolation, loneliness, anxiety, depression, and even suicidality. Veterans often feel a lack of guidance around this transition, feeling misunderstood by civilians and disconnected from the general public. Because veterans often feel comfortable speaking to other veterans, peer resources can be especially helpful in fostering connectedness and providing guidance. Physical health issues such as chronic pain or social difficulties around family, employment, or other issues are often associated with mental health challenges, most commonly depression. In order to best serve student veterans, it is important that health professionals, especially those in counseling and psychological services, undergo specific training on veteran mental health issues. Mental health professionals can create opportunities to meet with veterans in non-clinical settings to explain what they can offer and normalize both mental health concerns and treatment. Peer resources, such as a veteran center or student organization, can promote the efficacy of seeking help for mental health concerns. Good partnerships with the VA can provide for smooth referrals to many services that are available. However, some veterans shy away from the VA because of a fear of having mental health issues on their record, so partnerships with other community health resources are important as well. Note that veterans have a wide spectrum of emotions and experiences with respect to their service and transition to civilian life. It is absolutely vital not to stereotype, but rather to listen to each veteran, validate their experience, and respond to them as an individual.